Hi guys, just a quick video about. I was just thinking it's related to ADC exam, but it's also related to you as a clinician basically. I understand a lot of people had problems in solving the cluster 1 questions and could not pass that cluster in the last September exam and this March exam also. Cluster 1 is basically information gathering. And not only that, as a freshly passed out graduate, when you start practicing in your clinic, sometimes I find the newly graduates often a little hesitant as to how to approach the patient, or sometimes they get intimidated by the patient when the patient comes and say, "Doctor, I'm having pain in this tooth. Can you please do something about it?" And in order to please the patient or just appear to be a confident doctor, they just tend to focus on that particular area and they don't check the rest of the mouth, which can give them so much of information and some other treatment that the patient might have required. So I feel when you are in your third year of studies, like when your clinical postings start basically, and you're all excited because finally you're going to touch the patient and interact with them. The most important posting that I was thinking, I mean, initially we know that for a third year, fourth year, and an intern, the most interesting postings for us are endo, oral surgery, prosto, because we actually get to do some work and we find the OMDR okay. Ortho, we basically sit and either adjust the retainers but not too much work. And community dentistry, well, we kind of just had the most fun in that posting because there's literally nothing to do. But I feel the most important posting is OMDR, and I'll tell you why. See, that is your first contact with the patient. Now, even as a freshly graduate, and if you try and incorporate what I'm going to say now, you'll be able to clear almost any exam which are based on communication OSCEs, and you'll be a very good clinician and a confident clinician. See, when a first time a patient comes to you, and I'll give you an example of it. Suppose a patient came to you with a broken tooth on say 4-6, and he also happens to have an ulcer on the lip. And his chief complaint is the broken tooth. He's not much bothered about the ulcer because for him it's an on and off. So the patient comes to you and you're a fresh graduate or a third-year-old or an intern. What you'll do is you'll just in general check the mouth, you'll mark it on the paper, if required you'll send for the x-rays, and on basis on the x-ray what you see, you'll just refer the patient, go to the rest department. You say go on the 3rd floor or go on the 4th floor, and that's about it, because you have other patients to examine. No, you should not be doing that. What you should start doing is, when you get a patient and when he lays down on the chair, instead of directly asking him to open his mouth, you ask him in detail about the chief complaint. Now the patient says, "Doctor, I'm having pain in my 4-6." You start asking him questions. Don't just try and jump onto diagnosis or just mark it on the paper. You ask him since when the pain had started. So I'm giving you a structure here, okay? You will first ask about the chief complaint, which is that tooth. Don't jump to investigations right now. Just without even touching or opening the mouth of the patient, you're going to ask him, since when the problem started? Is this your first time? Have you ever got a dental treatment done before? Do you have any medical problems? Any medication you took for it? Are you having any allergy? You figure all that out about that particular tooth. Now once that is done, then you ask him about his oral hygiene, like how does he maintain it. You'll get more clues and you note it down. Then you will ask him about what is he expecting out of you today, like what treatment is it. You always should be aware about the patient's expectations. You're also building a rapport with the patients. Now once you are done with these basic primary questions, then you tell him what investigations you're going to do. Don't just tell him go get an x-ray done. No, you're going to tell him, listen, we need to click a picture of your tooth, we need to take an x-ray to see what is happening inside. Based upon that x-ray, we will decide what treatment is needed, but I need to also examine your other teeth. And then when the patient opens the mouth, do not jump on tooth 4-6 to see what is happening there. Because when you are going to focus in the area of the problem, you will by default ignore, or kind of it's going to slip away the problems happening in other areas. So for me, when a patient comes and says, "Doctor, I'm having pain in this tooth," I'm like, open your mouth, and I deliberately start examining from the opposite side. And how I start examining, I examine the gums first. I will see the quality, texture, everything. Then I will focus my gaze on the teeth. Now with practice, you can just take one short look and you have kind of observed everything. But for you as a budding trainer, as a budding doctor, take your time. It's okay. Na? Patient has come to you for checkup. He will sit and open his mouth. Nicely examining the gum. Start from the last tooth. Come all the way. Take the upper quadrant. Take the upper right quadrant here, and then take the lower right. Finally, the area. When you're going to examine all this, you might find something. You might find some caries. You might find some deposits. Note it down. Then coming on to the chief complaint, you tell the patient, see, I could also find these many things, and once you are done with your chief complaint, you need to come back and get correction of all these things, otherwise you may have other problems too, and explain them the consequences. Do tell them this also, that there is an option of not doing anything, but then that is going to lead to more problems. You should not always appear like there is a problem and it has to be fixed. Yes, it needs to be, but then the patient also has the option to not do anything. So the patient needs to make sure that he has a choice, and whatever choice he is made is for his benefit. You are not there to convince the patient. You are there to give them the facts. The decision would be made by the patient. And when you start approaching like this, and when you this is how you'll develop your communication skill. The patient might have further questions asking you. Now, when you talk so much and communicate and are genuinely describing him the entire consultation process in your private practice, the patient would really appreciate this. Okay, and even though suppose you're just a fresh graduate and you saw that tooth needs a root canal and there is an ulcer in the mouth which has been there for a long time, and you think it needs a biopsy or something, you are not doing anything because you can't do these things. So even if you refer to a particular doctor, you are going to prepare a nice referral letter, or you're going to message your doctor, and I'm sending you this patient. You will tell the patient, listen, I'm going to refer you to this and this doctor, and this is what you need to get it done, because he has more skills than and tools that I have at the present moment, and I want the best treatment for you. But once this is done, you have to come back for follow-up. You will never lose that patient. That patient, time and again, even though he may know you may not be able to do that particular problem, solution for that problem, he will come to you for advice. So this is how you develop the patient relationship, and they will follow you no matter wherever you go. I have patients where I had started practicing in 2015 in a very X location in Dubai, and I moved almost 30 kilometers away from that place, and my patients still follow me. Sometimes so many of them I have just referred, I've done a full consultation and I know there is nothing more I can do for the problem that they are having, and I've referred them to other doctors, and they are still coming back to me after their problem is solved, just for a follow-up or a checkup, or they have something, and they refer so many more patients. They are like, the doctor will explain you, just you are in good hands. That is what they say. So always have a focus on building a very good practice. Even if you're working for a corporate, or even if you're working for yourself, you work for dentistry. Always remember that. You're not working for a particular boss. You're not some finance advisor that you're working for your boss, okay? You deal with healthcare. You're working for science. And if you respect and appreciate it, it's always going to bless you. I hope this video was helpful for one and all. Any questions, any doubts, leave a comment. Thank you.